Hello, everyone. Thank you for joining us for Athenahealth's Marketplace Partner webinar series. Today, we are joined by CallMyDoc. A quick housekeeping item for today. We will be taking questions throughout the webinar. To submit your questions, please click the Q&A tab at the top of your screen and enter questions there. After the presentation, we will open up for live Q&A. Lines will be opened. You'll be asked to raise your hand if you have a live question. And once you're called upon, you can ask your question. I'd now like to turn this over to Carl of CallMyDoc. Welcome, Carl.
Hi, how are you? I want to thank everybody for joining today. We haven't done one of these in a while, but we thought we should because the sophistication of our system and being able to reduce the labor it takes to manage a zillion phone calls is gone up tremendously. We've done 22 million patient calls to date. And so we want to bring people up to speed on what we've been doing lately, how it works and why it works to make it extremely simple to deal with phone calls to your practice. So what is CallMyDoc? It's fairly simple. I mean, you can read this, but at the end of the day, it bridges the gap between your phone system and your patient charts. Okay, so in other words, 80% of the people that are calling your practice are already in a database called your patient charts. Most of the communications with any practice in the country, in the United States, is something to do with the phone. So the problem is there's a huge gap between the phone system and the charts, and that's where all your manual labor comes into, whether you're doing something after hours, during the day, et cetera, et cetera. Our system's designed to get rid of as much manual labor as possible and to make everything streamlined and trackable and measurable, so you always know what's going on if a live person can't pick the phone up for any particular reason. Now, the reason why we cut daytime phone calls by 50%, there's several pieces to it, okay? One piece to it is that if you don't have something like our system in place, then anything a live person can't get to becomes a manual process. So imagine you have to listen to 30, 40, 50, who knows how many voicemails a day. You've got to look up the chart. And the other problem is your ear can only go so fast. It's linear. Your eye, when you scan this slide, your eye is at least 5 to 6 times faster than your ear. So when we transcribe things, we transcribe them automatically back into patient cases. And all you're doing is reading the patient cases and doing whatever it says. And that's it. You don't have to do anything else, period. The other thing about our system is that if somebody says they called you 5 times on Tuesday and it's not in a patient case, they didn't call you 5 times on Tuesday. Or another reason would be if a stat lab result comes in at 4:55 on a Friday evening, it's not going to be in a voicemail till Monday. It's immediately in a patient case, immediately tagged on our CallMyDoc dashboard, which I'll show you in just a minute. Now, when it comes to after hours, I'm amazed that in 2025, how primitive after hours is in the United States. Obviously, it's a requirement of all the insurance companies, and it's a requirement for Medicare, et cetera, but it doesn't dictate how you need to do it, okay? And the way it's done to now is mind-blowing. With our system, we have an app that supports Android, iOS, and we also have a desktop version. The app can be used by anybody. I'm going to specifically show you a demo of how it works after hours. But at the end of the day, it documents every phone call, puts it back on the chart. The provider on call doesn't get a live call thrown into their lap at 3 o'clock on a Sunday afternoon. They get to screen their calls. They also get a small chart summary of the patient's 3 most recent visits, et cetera. So the whole thing is a completely different experience in terms of low stress and the speed with which you could deal with calls when you're not in the office. Now, I'm going to briefly touch on a company and the statistics that they were able to generate. Unfortunately, we aren't allowed to say exactly who they are, but it's a very large provider in Florida. And just like everybody else, 80% of all communications with any practice in the United States has something to do with the phone. And, it's you could try to force patients to use the patient portal. They're not going to do it. I mean, I don't know if you remember when Medicare came out with that measurement of, I can't remember what it was called, but basically they were telling all the providers, you have to force patients to use the patient portal and you're going to get measured on it. And people aren't going to do it. I mean, most people just pick the phone up and that's it. It's very difficult to get away from that. I know there's lots of apps, that can do a variety of different things that aren't phone related, but we just focused on every problem that has something to do with the phone. So after all these 7 years that we've been doing this and 22 million patient calls, CallMyDoc is basically a Swiss Army knife to fix any phone problem you can come up with. And because we've done 22 million patient calls, we know why people are calling, what they're calling about, the average length of each question, et cetera, et cetera. Okay. Now, this chart has got something very specific on it. When I say that we can cut your phone call overhead by 50% and make it 3 times faster to deal with calls after hours, it's based on actual statistical data and measurements. In other words, if you look at a billing question, the average billing question is 22 seconds. It's going to take at least 20 seconds to listen to that whole thing and look up the chart and do a bunch of other stuff. At the same time, when you do it with CallMyDoc, it's about 3.5 seconds. And this has been measured across the boards. The other thing with CallMyDoc too is because everything a live person can't get to is trackable and traceable. The average callback time, I mean, at the top it says 6 hours, but if you really look at this, they're averaging anywhere between 30 minutes and 2-hour callback time all the time for most issues. Now, if you look at the ones where it says over 24 hours, 48 hours, more than 48 hours, those are most likely related to issues where somebody called in and said, hey, I need you to call me back. Click. I mean, we cannot stop patients from doing things like that. But by the same token, the bulk of these, if you added up all these bars, is much higher than anything else that can be achieved. The other thing that this shows, and this is one of our dashboards, which we're going to show you in just a minute, is that this can all be measured now. This is measured, the way we measure this is measured from the time that we transcribe a message. And by the way, we transcribe messages at basically 100% transcription quality in 15 different languages. And so when we push a message that comes in Spanish or Arabic into a patient case, it's also converted back into English. So this is all measurable and measured by the time that we transcribe that message into a patient case to when they close the patient case out. And that's how we determine these statistics and information. Now, I'm not going to belabor the point here, but basically, they notice a significantly happier collection of on-call providers by using the app, because if a call comes in, you can screen your call. You don't get blindsided by any weirdness. It documents everything. You can leave a note for the staff that goes back into a patient case if they need to follow up. And in cases where it's simpler, or maybe it doesn't even require you to call the patient back, you can actually send a prescription or do other things, and the app can call the patient back on their own and tell them to do this, that, and the other thing. And if the patient called in Spanish, it's going to convert it back into English. You're going to be reading and working on the app in English. If you have CallMyDoc call the patient back in English with what you wrote, it'll call them back in Spanish. So again, I could show you many sites of all different practice types, because phone calls are phone calls are phone calls. It doesn't matter what type of practice you have. We have examples of every practice you can imagine that's using our system, anywhere from one provider up to several hundred providers. The other aspect of our system is you need to prioritize which calls get answered by a live person and which calls do not necessarily have to get answered by a live person, because not every call has the same level of priority. And there's two pieces to that. One piece of that is that you prioritize which calls go to a person. If that person cannot answer, it rolls to a CallMyDoc phone number, and then we track it, et cetera, et cetera. If somebody calls in the middle of the day or whenever and has a medical related urgent problem, you can use our app to monitor what's going on. And for things that can wait, like requests for medical records, billing, referrals, other types of stuff, people have us transcribe 100% because it doesn't have the same level of priority. So when you compile all this with just reading this stuff and you compile it with prioritizing what people need to do and what they don't need to do, it's a completely different picture in how you manage your practice and manage the phone calls in your practice. So at this point, Nikki, I'm going to go to a live demo. And hopefully Nikki taught me how to do this correctly. So, Nikki, does this look good?
You're good.
All right, so you're not on mute. Okay, so here's the easiest way to explain this. I'm going to show you live how all this stuff works. And this is set up a certain way to illustrate what we do and how we work. We do not charge by the number of phone calls. We do not charge by phone call minutes. We do not charge by the number of phone numbers. We'll get to the pricing a little bit later, but the pricing is one of our best features. The reason why we don't charge by the number of phone numbers you use is because every phone number can be programmed like a staff person to handle calls in a variety of different ways. So in other words, I'm going to show you how this is currently configured as an after hours answering service. And we're going to look at this app. And at the same time, I'm also going to talk in more detail about the daytime usage. Okay. So let me call that number and I'll explain what's happening as we go through this.
Athenahealth test office. The office is currently closed. If this is a medical emergency, please hang up and call 911. If you are an established patient or calling on behalf of an established patient, please press 2 immediately to be helped. Please enter the patient's date of birth by using your keypad to enter 2 digits for the month, 2 digits for the day, and 4 digits for the... You have entered September 18th, 1963. Please wait while we look up the medical chart for the patient. If you have a question about your bill, labs, insurance, or some other message for our office, press 1. If you have a question about your schedule or to request or cancel an appointment or get directions to your next appointment, press 2. If you have an urgent issue and need to speak with the provider on call, press 3.
I'm going to press 3, then I'll explain what's happening behind the scenes here in just a second.
Two 5573. If yes, press 1. Please say the patient's first and last name. When done, press any key. Then you will be asked for more information.
Carl Silva.
Why you are calling, any symptoms you are experiencing, and any other information that would help us expedite this call. Once you are done with your message, you can hang up and the office will return your call as soon as possible.
Okay, at this point, it's listening to me. Everything you've heard so far, the call flow, the workflow, the prompts, everything, 99% of it can be customized to say or do anything you want for your specific telephone problems at your practice. This is just set up a certain way, but we currently handle 750,000 patient calls a month. I can guarantee you if you plug this in tonight or tomorrow, your patients will just start using it. There's no patient training involved here. It's, I have a phone, remember when I was born, and possibly my last name, and I'm able to use the system. But let's continue on this, and I'll show you where the stuff winds up in Athena. There it is. Okay. So as I mentioned, you get your Call My Doc number or numbers. At a minimum, we set you up with two numbers, one to use after hours and one to use during the day. However, like as I mentioned, you can have as many phone numbers as you want because I'm going to show you a variety of use cases for how people are using these numbers. Patients call in, they're going to enter their date of birth. If there's more than one patient with the same chart, we might ask for the first three letters of their last name. I can guarantee you, though, at 100%, that it will resolve it to one chart, period. The only time it wouldn't do that is if two patient charts had exactly the same demographics, which is an extremely rare occurrence. It has happened once or twice. Other than that, it's always going to find a patient down to one chart. Now, in this demo, there's three things they can do. Now, the first question it said is, do I have, well, these are the different languages. Not only to support these different languages, we support all the accents of different languages supported by Google Assistant and Amazon Alexa. But when I first called in, it said, do I have a non-urgent question or problem that I want to deal with? Okay, so the idea behind this in particular is that something starts over here and then goes directly into the task inbox or patient case inbox or whoever can work on that particular problem. Now, these are the 12 patient case types in Athena. You can have a phone number or multiple phone numbers or anything that you want that's programmed to handle these different types of patient cases and transcribe questions that are inbound directly from the patient or some other caller into patient cases at 100% transcription quality. The second question is they had a question about their schedule. So there's two things about this. Well, first of all, no matter how you want to use this, your scheduling system, if I couldn't remember when my next appointment is, all the phone numbers are connected to the chart, so it could look up when their next appointment is and text it or email it back to them, and not only send or text in or an email, but also a hotline they can click on in Apple Maps or Google Maps to tell them how to get to your office or whichever office they're supposed to go to. The second thing this can do is we can cancel an appointment in real time, but it behaves like a person. So in other words, if I need to cancel an appointment and your practice has a 24-hour cancellation policy, it'll say, I'm sorry, we can't do that now. Call the office back directly. And then we can do one or two things when it comes to patient scheduling. One thing we can do is we could simply transcribe their request directly into a patient administrative patient case. The other thing that we can do is if you do actually allow at least one appointment type and at least one provider to be self-schedulable through the Athenahealth patient portal, we basically are a phone interface for the Athenahealth patient portal, and therefore we have the ability to schedule patients over the phone with their own date of birth and last name in 30 to 40 seconds. But you have to have the Athenahealth patient portal enabled for it to do that. Other than that, we would just transcribe it. Then the last question is, I want to leave a message or I need to reach the provider on call. So again, just like a person, we could use the usual provider on their chart. We could use the last provider they saw. We could mix and match various parameters because we need to do that because it's going to behave like a person and automatically transcribe these things into patient cases. So we're going to look at a patient case in just a second. Now, I can either work from here on the patient cases or I can work from here. So I'm going to just show you if I work from here, what happens. It just put that note and my name on that patient case, which we'll see and look at in just a second. Hang on, I forgot a piece here. So the app is how you manage calls when you're not in the office. Let me finish this part first. How I get notified, when I get notified, if what types of calls I get notified is completely customizable. All this information is coming in real time out of the patient's chart, and anybody can use this app. It used to be primarily for providers after hours, but actually it could be used by any staff or other people at the practice because having the app is like having all your charts and your phone system in your pocket at all times. So anyways, who's this patient? What do they want to talk to me about? Pretty simple, right? Click on patient chart. I get a summary of the patient's 3 most recent visits. I got allergies, active medications, labs, and other documents. And if I click on this, not only are you going to put the lab results on the screen, but if I click on this printer, I could print it on a wireless printer at home if I wanted to do that before I call the patient back. So the routine is you get notified, open your app, who's this patient, what do they want to talk about, what's happening with this patient lately, and then you click on respond. Now there's 2 choices here. The bottom one is, let's say that I was using the app and there's another provider that's using the app, but I'm not quite sure how to deal with this. I could forward that to another app user and all the usual things would kick in. However, if I'm going to work on it, I have to hit take session for 2 reasons. First reason is because we document everything between take session and close session. Okay. The second reason is because that way no one else can duplicate, by accident picking up the same call. So if I want to call the patient back, I hit this phone icon. Now the top button is the number they want to get called back on. The 3 other numbers are the numbers also on their chart. And if you've been seeing a patient for a while, they'll go out and change the phone number, get a new cell phone, or maybe their battery died on their phone. So I'm going to hit the top button because that's the one they said they wanted. This is going to set up a real-time conference bridge between me and the patient. And now you can hear my patient phone ringing, and this would ring with the caller ID of my of your practice. So I'm going to answer it. Okay, great. Now we're connected. But as I said, because you could screen your calls, you can also have the app call people back on its own. So let's click on add response, and let's say that this patient called about a refill. And we do not do controlled substances. But what this is going to do is it's going to send the refill to the pharmacy. Then it's going to update the chart, and then it's going to call the patient and tell them where to pick it up by itself. I'm also going to have it call the patient and tell them something. I sent in your refill, but we haven't seen you in a really long time. So when you get a chance, could you please schedule a time to do a medication review? And then lastly, this little box at the bottom is to take progress notes about the call or leave a note for the staff. All this stuff will be in the patient case, which we'll see in a second, but I'll just put a little note in here. I sent in this patient's refill, but we haven't seen them in 2 years. So when you get in on Monday, could you see about scheduling for a medication review? And then that's it. And then I hit close session. Now the app's going to do what I told it to do, like this. Hello? You have to talk to it.
Returning your call. A patient at this phone number contacted us with a medical issue. We are calling back now with the provider's answer. If you are the patient or a HIPAA authorized individual, press 1. Athenahealth test office has the following information for you. You can
The app tells you when the patient got their message.
Provider has prescribed the following medicine. Athenahealth 0.1% topical cream. Every day by topical route. The prescription has been sent to the pharmacy. CVS 16050 in Target. Located at 3433 Sepulveda Boulevard. If you would like to confirm it is available at the pharmacy, you can call them at 310-370-1021. Please note that depending on the type of prescription, the prescription order may have been sent by fax, so the pharmacy may have to check their fax machine to fill the order. Please ask the pharmacy to check their fax machine if they say they have not received it.
Tells you the pharmacy got the prescription.
Really long time, so when you get a chance, could you please schedule a time to do a medication review? Press 1 to repeat this information. Press 2 to confirm you have. Do you wish to start a new session with the provider for another issue? Press 1 for yes. Press 2 for no. Thank you for calling Athenahealth Test Office. Goodbye.
Well, I'll point out one other thing about this. So we cannot yet transcribe live calls between English and other languages, but I can tell you if the patient had called in Spanish or some other language, this transcription would be in English, and any of these types of responses, it would call them back and tell them about their prescription and your message back. It would convert it back into Spanish or Arabic or whatever language. So this is what we call the dashboard, and I got a little bit ahead of myself, so I apologize for that. But anyways, this is, let's say I come in the next day and I have a look at this. Now, the reason why I put this in here is because that way people that are working on the patient cases aren't doing the same thing that I'm doing. But that's in the patient case. All of that's in a patient case. And the session log is a detailed record of everything that ever happened, period. Okay. So in other words, if I take this patient case ID, I can go into Athena and let's have a look at what it looks like in Athena. And I'll explain a little bit more about this as well. Okay, so there's my note. I didn't have to do that. As a matter of fact, people don't even need to touch this except for some of the statistics and reports that we do, which I'll show you in a minute. At the end of the day, the requirements to use this in terms of staff training are, do they know what a patient case is? Do they know how to read the patient cases? And they know how to close the patient cases and follow them up. There are no other training requirements because it looks just like this as if a person had typed it in. You can have a phone number, multiple phone numbers, or anything that makes sense to fix any horrific phone problems you have, because we don't charge by the phone number, et cetera, that can automatically take care of and transcribe any of these different patient case types. This here tells, oh, wait. So like I said, we always take the patient's callback number down because if you've been seeing a patient for a while, they'll go in, they'll check in, they'll check out. They'll never tell you they changed their phone number or who knows what. So we've got to take that number down. This tells you which dashboard it came from. So in other words, this could have said refill request hotline. This could have said billing questions. This could have said Little Company of Mary emergency room, Torrance Memorial emergency room, etc. This is a unique identifier for every call we've ever done. So if you give us that number on our side, we could track routing and a variety of different things. And then let's just say that this was a billing question. Well, you could decide what calls go to the app and which ones do not go to the app and which ones you want to deal with live and which ones you don't. And at the end of the day, if this was a billing question, it would look like that, period. And if it was a billing question, then again, the different languages would still look like that. But because we worked on it, we grabbed it. Remember, we had a take session from the app and we did this other stuff. These are the actions we took from the app. And then the most important thing is this note down here. So if I go in here and I close this out, I say the patient was scheduled or whatever, save. Within 20 to 30 seconds, it's the same thing as if I clicked on this. So I can either archive it from here and it closes the patient case, or I can archive the patient case and it's like I hit that blue button. Either one of those events mean, okay, we're finished. Take all notes, all documentation, all details and put them back on the chart under other documents, phone message. And here we go with the summary at the top and extreme detail at the bottom. And if I click on view original image, these blue lines are hot links which we keep forever. So because you can't attach a voicemail yet to a patient chart, this is how we've been doing it. But at the end of the day, everything's going to be written down and documented and nothing can get weird or people cannot, do anything strange because it's all written down and documented. So at the end of the day, you get something like this. Actually, no, let's try this one. Okay, ThinkMed First is split between North and South Carolina. I don't know how many locations they have now, maybe 12 or 15, but this is everything that's happening live in North Carolina. Now, when you look at this, we're not trying to replace patient cases. Well, when you look at this, it's pretty easy. Again, when it comes back to quote training, whatever, it's super easy to look at this and say, okay, somebody needs to handle these 28 urgent calls. Somebody needs to handle these billing calls. And also, if a question of this nature is not in the system, these boxes only pump up if there is. Other could be new patients or other types of callers. But as I mentioned, we keep reports and statistics on everything that's occurring. So in other words, Monday across the state of North Carolina and South Carolina is pretty rough. These are actual patients using the system. We're handling about 10,000 calls in overflow. And you can see Lillington front desk is hammered. Maybe they have a staffing problem, who knows what. The second biggest is James City. And then on their response time, they're doing pretty good in general. They're handling patient cases pretty quickly. And unfortunately, this eye chart, we need to do something about this, but basically it just shows you that the peaks are billing questions. I'll show you why that is in a second. After hours, non-urgent, and Lillington front desk. But the reason why the billing one is so high is because for billing questions across the state, both states, 100% of those billing questions go here. They're transcribed and then they're followed up by people. So that way they know what actually happened and occurred. 100% of the referral requests as well go to that number, no matter where you are. So in other words, if you call in, it says press 1 for a billing question or press 2 for a referral, it's going to go to one of these 2 phone numbers automatically. This is another site we have. Aspire, Indiana, they're using this for free things right now. I think they have 87 something providers, but at the end of the day, 100% of medical record questions go here. 100% of the refill requests go here because they were getting a lot of complaints about people that said they were calling in for a refill and this and that, and they wanted to be able to track where this stuff went. And the same thing for people calling about lab results. So at the end of the day, that's kind of all the different pieces. So, Nikki, what do we need to do to go back to the presentation?
Getting you pulled up right now. 1 second.
And then I hit take control, correct?
Correct.
And do I need to stop sharing?
Nope, you're good.
Oops. There we go. Okay, so CallMyDoc is, oh, no, we're way behind here. Hang on, let me get to where we're supposed to be. Okay, CallMyDoc could do a lot more than I even showed you. We can route calls. There's a lot of different things we can do. We could text different types of information to people. So in other words, for instance, for medical records, if you call the CallMyDoc number, it might say, if you have not already sent in a medical records authorization form, press 1. And we'll text it back to them, and then they can fill it out and send it in. There's a number of different things I haven't even showed you. So CallMyDoc replaces answering services, replaces call centers, replaces voicemail, and does a lot of different things. And because of the way the efficiencies it puts into your practice, there's a gazillion things that it can do. At the end of the day, it's going to make you 50% more productive. And the reason why we know that is because with our system, you pay nothing up front, you pay no one-time charges, and you get a minimum of 30 days to try it out for free. And the reason why that is because 99.9% of the people that start using it after the end of the 30 days keep it. This is just a little bit more of, I don't want to call it an eye chart, but at the end of the day, the way our system works during the day is that the green stuff is your phone system. Okay, so you don't have to throw out your phone system or anything like that. The blue part is CallMyDoc, purple's Athena. And the point of this is that, as I mentioned, you can have as many phone numbers as you want. So for things that can wait, you have your phone system route those calls to a CallMyDoc phone number. The other reason why we just use plain old phone numbers is because you can call them and test them. and make sure it's doing what it's supposed to do before you plug them into your phone system or you turn them on live. And the other reason we use the phone, just plain old phone numbers, is because all we're doing is using a feature that was invented in 1987 for call centers. So your phone system thinks it's transferring the call if no one can pick up or the lines are busy to a call center, and it doesn't matter. We fake it out. It's just the phone number, and then we kick in and take care of the rest. So we bridge the gap between the phone system and the charts to make everything 100% trackable and 100%, 50% more easy to use. Obviously, the visual voicemail thing. And then, as I mentioned, we have lots of key performance indicators around phone systems, around, when people are calling, how they're calling, et cetera, ad infinitum. So at the end of the day, if you want to try it out for free, and then we'll open this up to questions, maybe save you a little bit more time, is we don't do one-time charges. You get a minimum of 30 days to try it out for free. Now, we say that because we have to say something, but at the end of the day, we know this is healthcare. Things change. So, we can be flexible on that. If you want to keep it, it's extremely simple. It's $139 for the first provider, $54.99 per additional provider, month to month. We don't lock you into a contract. And at any moment that you feel it's not working out for you, you can cancel. If you want to try it out, you need to fill out obviously the Athenahealth Marketplace consent form, which is pretty easy to find, but I don't know, Nikki, if you're going to send this presentation out to people. And then if you want to dive into more use cases and discuss more specifics and specific examples, that actually is the best way to learn about CallMyDoc, because in 15 to 20 minutes, 25 minutes, we can be very specific about exactly what it can do to deal with your calls during the day and after hours, or both, depending on how you want it set up. Okay.
Hey, Carl, I'm
So,
going to interrupt really quick just so the audience knows these links are live, so you can go on your screen and actually click them to access them right now. They're also pinned in the Q&A.
really? Oh, that's cool. So I should not move off this chart. No, I'm kidding. I mean, at this point, we're just going to talk about questions. So, Nikki, do you want to roll the questions thing and however that works?
Yep. So I'm going to allow microphones right now for our audience members. If you have a question that you'd like to ask live here with Carl, please raise your hand by clicking the raise button at the top of the screen, and we'll call on you. You can unmute. Ooh, I'm going to try here. Babatunde?
Did you got it?
Yep. You can go on ahead and unmute and ask your question.
Yeah, can I have, because I didn't join, I was doing something, and is there any way I can get a copy of this presentation? I can see what's going on.
Yeah, if you're registered, we'll be emailing out the recording after this event.
Okay, thank you.
And then there's Amy.
Yes.
Hi. Yes, thank you for the demo. I was just curious, do you have like a locum pricing for the additional providers, or do you do like APP, like nurse practitioners versus docs?
I forgot. Yeah, no, I forgot. So I'm sorry. I should have put a finer point on that. The pricing is, if you just use it after hours, it's only applicable to who's on call, A. If you use it during the day, then it's applicable to the providers that work at a particular location. So if you just have it at one location, that's pretty straightforward. And then the last piece that you just mentioned is it's based on full-time equivalents. Okay. This particular part of our system, quite frankly, even though we can build you a space shuttle to handle phone calls, is actually the funkiest part of the entire system, because it's very difficult to track who has what providers, who's working full-time, who works 2 days a week, et cetera. So quite frankly, we base it on what you tell us, because there is no other way to do it. So at the end of the day, if you have, 2 providers that are work 50% a month, that's 1 provider, et cetera, ad infinitum. Does that make sense? In other words, treat that number on the third bullet as common sense as you could think about it, because that's how we work.
Got it. Thank you.
And also, let me add a piece to that why we do it like that. My wife's a doctor in primary care, and we came up with this idea 14, 15 years ago on our first date because I couldn't believe the amount of suffering that you guys have to go through when you're dealing with patient calls, either in the office or when you're not in the office. It's unbelievable. I mean, it is 2025. You'd think this stuff would be fixed by now. So that's what we're trying to do. Lauren?
Yes. Hi. Thank you so much. I have a question about the after hours calls.
Yes.
Is it possible, when you're building or customizing that back end to screen and push calls through that fit certain criteria, like whether, the patient uses certain keywords in the message that they're leaving?
Yes and no. I would tell you that the current version of our system, you notice, is somewhat touch tone based. Okay. And the reason why that is because you can't get to what you just said, Lauren, unless your transcriptions are almost perfect. So we had to focus first because none of the commercial systems are capable of dealing with healthcare. I do not know why, but in terms of transcriptions, the other problem that you have is people in this country aren't from this country, or however you want to describe it. So the way that I say Lauren and the way somebody else says Lauren could be totally different. So we've trained our system on being much better on how to understand what people are saying to begin with. Then the second part that we're currently working on now is that people could say their name and say their date of birth and then say their legal first and last name. And the last piece that we will be introducing sometime later on this year is exactly what you just said, Lauren, that it will understand anybody who's calling and what they're calling about and be able to do exactly what you just said. But we have to get through these other pieces first. And because it's healthcare, it must be perfect. So that's why we haven't quite got there yet. But we've been working on the AI portions of our system for over 2 years now, even before stuff like ChatGPT and these other ones, Grok, et cetera, came out, because the only way to overcome what people do and say is you need something smart enough to figure it out. We actually started working on it, not because it was cool, but because people don't pay attention to instructions or listen to anything. So somebody might press the refill button and then say, I need an appointment. And that's why we're doing our AI stuff. So the system becomes more and more efficient and even better and more proficient at dealing with patient calls without you having to suffer through a zillion calls. Anybody else?
Thank you.
We have a couple in the Q&A as well. Are we able to answer live calls? Can we keep the same phone numbers?
Sort of. I mean, yes and no. It's not exactly the way you would think about it, but at the end of the day, it can't completely replace your phone system. And actually, let me put a finer point on that. I wouldn't do that. It can almost replace a phone system, but there's a variety of reasons why you might not want it to do that, which I could explain better one-on-one, depending on your use case. But at the end of the day, you can shoot live calls straight through. The problem with that, though, is that you want to use the CallMyDoc app to deal with calls, because what's happening is it's tracking every single thing that occurs. So there's not going to be any discussion or mistake in the future about what happened, when it happened, et cetera, et cetera. It's always going to be written down. When it comes to, I don't know, Nikki, do you want me to go through the Q&A, or do you want me to go through, are there more people that have live questions?
We can bounce back and forth.
All right. Well, Beverly said, after hours, is paging a doctor available or only texting? Every form of communications that would wake up a doctor to let them know they need to have a patient call is there. As a matter of fact, it's got a miniature escalation procedure and a zillion different ways that it can actually mention to people, hey, you need to answer this call or this and that. So it has a zillion ways to get people engaged, if you will. Let me rephrase this. It's impossible to miss a phone call using our system, because you could set it to be a little annoying more annoying or totally annoying, and we'll take care of it. In terms of all the languages that are supported, we deal with a lot of FQHCs. So we deal with most of the languages that need to be supported. The only one that we don't have at this point in time is Creole, for a variety of different reasons. At the end of the day, there's no good models out there or no good starting points for Creole. So the only way we could support Creole is if we created our own system from scratch, and it's not financially viable yet. What else here? Are there any other questions? Have I missed something?
Yeah, let's go to Sandeep if you want to unmute and ask your question.
Yeah. Do you guys integrate with Ring Central?
Yes. As a matter of fact, we have a lot of different Ring Central sites. And let's talk about what do we mean by integration. We're just phone numbers. For all practical intents and concerns outside of CallMyDoc, it's just a bunch of phone numbers. Each phone number that you tell us what they're supposed to do, like you would teach us how to teach a staff person on what their job is. Okay. Mm-hmm. So let's say you have 5 phone numbers. That's part A. Part B is then you call those numbers to make sure that what we've set up is doing what you expect it to do. Then part C is you literally just plug those in directly into your Ring Central system, exactly the way you would do it today. But in other words, instead of going to voicemail, there's a function on every phone system on the planet that was invented in 1987 called selective call forwarding, which is a fancy term for what should the phone system do instead of going to voicemail.
That makes sense. So this presentation kind of makes a lot of sense for folks who have a big need for after hours. For during business hours, when a patient calls in and we have a phone tree, we have different departments. So I guess we integrate it like based on the department and where they, like if they wanted a refill or they wanted to have a billing question, we kind of route it accordingly.
Yes, exactly.
Okay, and then once it gets routed, so all my in-house staff that are kind of either operators or that triage or handle incoming patient calls, what's their workflow look like? So they're kind of working out of either the browser dashboard, CallMyDoc, or the smartphone app. Is that essentially their workflow instead of answering that call?
Actually, no. They would work entirely out of patient cases, as if a person had typed in all those patient cases for them. And the only time they would have to touch the dashboard is if you wanted them to, for whatever reasons. Because remember, our dashboard is a different orientation of reporting information than patient cases are, right? Mm-hmm. But in general, the easiest workflow is they just work the patient cases. Okay. Now, there beyond that is that if you want them to have the app, we do not charge for staff to use the app. We have a desktop version of our app that staff can also use. They can call patients back automatically on its own. That's linked to our dashboards. So there's layers to that.
So this isn't like two-way messaging then, live two-way messaging with that patient then and there?
No, it's entirely phone-based. The reason why it's entirely phone-based is there's over 100 years of legal history about what happens with phones. Phones are point-to-point. Other methods of communications like email or texting does not have a guaranteed delivery, does not have a guaranteed response time. Phones do. So everything we do is with a phone call one way or another, whether it's inbound, outbound, et cetera, ad infinitum, it's all phone-based. And the other reason we decided to focus there first is because in the current environment, 80% of all communications with any practice are something to do with the phone. So there's no way out of it. So that's why we set up CallMyDoc to be able to deal with inbound phone calls, replace voicemail completely, take the labor off of the staff in terms of being able to deal with that. The staff just read whatever it says in a patient case and call them back in the simplest case.
Okay. So, and that callback, that's either automated through CallMyDoc or obviously the staff can pick up the phone and call the patient.
Correct.
Okay. All right. Thank you.
Bethany?
Hi, we actually use CallMyDoc now. It says
Uh-oh.
Pediatric Partners. Hi. Imposter, right?
Oh, wait.
So
Bethany,
no, I
Bethany,
have good
tell me
news. I
exactly
have
what
good
you
news.
think.
No, I have good news. So, I have good comments, I guess I should say. So the gentleman that was just speaking, so it was actually a game changer for us when we went into Call My Doc we used to get like probably to like handwriting messages, 100 of them a day. To now it all goes straight into our EMR. So it's great for our practice. As far as I was just wondering about the live calls. I asked the live call question because that's something that we want to get away from Ring Central because we have Ring Central right now. So we're trying to, look at other options. But anyway, I just wanted to let the gentleman that
Thank
asked
you.
the other question. Yeah, it's very helpful for us as a practice. I mean, we're not super big. And we have 12 providers, 3 offices, but we're pediatrics, so we have a lot of calls.
A lot of calls.
A lot of calls. Yeah, a lot of calls. Anyway,
calls.
so that's all I wanted to say. I didn't really have a question.
Cool. Does anybody else have any other questions or anything?
We have one more in the chat. What languages are supported? And if you don't want to go through all of them, maybe you can give like a
The
note.
languages that are supported are, variants. Okay, so we support 5 to 10 variants of the following: English, Spanish, Portuguese, French, Russian, Ukrainian, Arabic, Romanian. I'm running out now, but off the top of my head here, let me just pull something over here for a second. I'll tell you exactly. Now, English, Arabic, Mandarin Chinese, Hong Kong Chinese, Cantonese, Danish, Dutch, French, German, Italian, Japanese, Korean, Polish, Portuguese, Romanian, Russian, excuse me, Serbian, Slovak, Swedish, Turkish, Ukrainian, and Vietnamese so far. And we add languages according to what people drive us to add. So, as I mentioned before, the only one we haven't been able to deal with yet is Creole. But other than that, though, we've covered all the other ones I described. Is there anything else going on? Any other questions? I mean, I think at the end of the day, I think our biggest use case is maybe during the day now, versus after hours, because as the healthcare industry's changed, people are getting more and more squeezed. Plus, the other thing is people are discovering, their staff quit, and then they realize their voicemail wasn't checked for 3 days straight, or who knows what of those types of categories of things. So this is also a like an insurance policy of making sure that everything a person can't answer gets tracked and dealt with 100% of the time. And then when it comes to the after hours piece, I can tell you what will happen because we supported some practices in this space. But basically, when you give them that level of documentation after hours, if there's some sort of a legal issue, and we create almost the same level of documentation during the day, when you give them that level of documentation to somebody, they just go away, because otherwise it's he said, she said, and it's with our system, it's real simple. Here's all your information on a USB stick. Good luck with that. And they just disappear. If you want to try it out for free, it's easy. Just let us know or set up an appointment to go over some detailed conversations. We've set up hundreds of sites. We probably set up now 10 or 15 locations a week, and we'd be happy to help you out. The amount of time it takes to set it up is approximately 30 to 40 minutes. The longest time it takes is the Athena approval. The Athena approval might take you 24 to 48 hours, but once we get the green light from Athena, we can literally set up your system in 30 to 40 minutes, which will be your initial setup. Then we have a conversation about making it perfect, and then you get to tweak it and fine tune it, and then you don't pay a nickel until you're like, this is cool, I want to keep it. Okay. Nikki, anything else?
Doesn't look like it. Let's hang on here for just a few more seconds to see if anybody else has anything. I'd like to remind everyone that if you click on Q&A at the top of your screen, and then Carl, if you want to go to your slide with the links, just so everybody has those one more time.
Yeah.
Thank you. Again,
That
these
one.
are live links, so you have them as well as in the Q&A. We will send the recording out to everyone registered after the event. If you have any colleagues that would like to watch this recording, I'll include in that email out the Success Community link. If they're not registered, they won't be able to view the link that you're getting in your inbox, but they will be able to go to Success Community within 48 hours and access the recording there.
That sounds great. I really appreciate everybody taking the time to look at this. We're focused on phone problems. So anything you have a problem with now, we probably can fix it or at least make it way more manageable. But again, thank you all for attending, and let us know if you have any questions, okay?
Thank you, Carl. Everyone have an amazing day.
Alrighty.